So we're looking at social impact as its own service line, which cuts across the organization, drives our mission, and so we've been focusing on a service line support model here in marketing communications for quite some time, and social impact is one of those service lines, DEI, ending racism, and so we've asked some of our great solid site leads to also do double duty in supporting the social impact team as well. So Linda stepped forward, and she's been a great partner, I know, with that process. So with that, I wanted to introduce Linda, who's going to give our report for the session today.
Thank you, Michael. Good morning, everyone. Thank you, Michael, and thank you, Diana, for inviting me to speak on behalf and to present on behalf of the team. So in today's presentation, I'm basically going to give an overview of how our team is delivering on the RWJBarnabas Health Anchor mission, and that's by our hiring of local vendors, our advertising in local and diverse media outlets, and increasing the visibility of our social impact and community investment initiatives out throughout the system. Now we can move to the next slide. So in 2021, we want to look at, we spent a little over $260,000 on advertising in publications that serve communities of color and marginalized populations throughout the state of New Jersey. So you'll see we have publications such as Out in New Jersey, Positive Community, WPAT, which is a Latino radio station, Local Talk, Latino Street, and Sino Monthly, New Jersey. And all of these publications are serving a specific business and strategic marketing strategy that meets the needs of our facilities as well as our regional or system needs. And you can move to the next slide. And so we continue. A lot of these are reaching our Hispanic population, as you saw before, Hispanic, African American, Jewish, Asian, and Russian populations as well throughout the state of New Jersey. And what it does really is extend our messaging. When we do this type of advertisement, these type of placements, it really helps us break through some of these language barriers as well as the cultural barriers that might be barriers to access to care and to knowledge of really what our facility brings throughout the state. So, and just to let everyone know that we do continue to advertise in all of these publications throughout 2022. Next slide. And so because so many of these publications are also owned by minority, minority groups, that is also part of our investment in local and diverse businesses. Now in 2021, that was a total investment of $15.6 million in local and diverse communications agencies. So you'll see many of our agencies that we work with listed here. And these are all certified, minority-owned, women-owned businesses. And in fact, as I was going through the list, I noted that all of them are actually women-owned, which is pretty amazing. Evergreen, we work with, is a woman-owned business, and we work with them on a lot of our crisis communications. Harmelin Media, NJ Mom, Aurora, Rachel Gary, and Solstice Communications are all women-owned media companies, and they're working with our teams across the entire system. Harmelin does our advertising buys. They buy our spots throughout the state and in New York as well, in this New York, New Jersey demographic. Aurora, many of our facilities work with Aurora on creating our newsletters for internal communication throughout the system. Rachel Gary has worked with us on many of our signature events, like the annual Running with the Devil's Race. She helped launch the Be Healthy initiative, working on the communication strategy for that, as well as the Field of Dreams launch this summer. And she'll be working with us on a social impact project, which I'll talk about later on in our presentation. NJ Mom is also a very popular blog, successful blog, mommy blog, if you will, that's what they call them. And so we've worked with her on many of the facilities, getting placements there, as well as advertising for our maternity, pediatrics, and children's specialized advertising. And Solstice Communications, another woman-owned agency, which helped develop a highly successful search engine optimization campaign for Newark Beth Israel. We worked with them very closely throughout last year to work on a campaign for our heart transplant program. And I know that they also do some joint venture, they do some web build outs for our joint ventures. So I just wanted to make a quick note about Newark Beth Israel and the work that we did with Solstice Communications, which was very effective. When we started our work with them in March of 2020, we had about 131 organic users to our heart transplant pages when people would do the search for a heart transplant for Newark Beth Israel. And we ended in March 2022 with 1,300 organic users to our heart transplant pages. So we were able to really move a lot of the negative placements that we received following the incident in 2019 that will not be mentioned ProPublica, but we were able to move many of those negative placements down, move a lot of positive placements up, and really maximize our owned media, our website, our video that we place on our website, our YouTube pages, our Wikipedia page. Who else do we have here? Atabay Consulting is a minority-owned and women-owned public relations agency run by Wendy Martinez, and she's been working with our system for many years. I know she's worked with Newark Beth Israel. She's worked with Clara Mass more recently with the help of launching their Latino Center of Excellence, and she's now working with our system, doing a lot of corporate communication strategy, as well as providing support for media relations and translation services as well. And I will talk about her later on as well because she helped with a very successful campaign here at Newark Beth Israel. So what else? Next slide. So that's one of the things that we do, obviously investing in local minority-owned businesses and in media, minority-owned media. But another thing, very important, is the actual earned media that we get, securing media coverage. And this year, we've been able to secure a really good placement in Newark. Again, I know we do a lot in Newark, but we had in April, students from Newark's Westside High School Business Club. They came to Newark Beth Israel to tour the greenhouse and give the team and the president of the hospital a taste of their hot sauce. They actually developed a Ryder hot sauce, and they used fresh ingredients from their own urban farm, and it's now on sale at our Newark Beth Israel greenhouse. So it's just a great example of how our social impact leads are partnering with local residents to support their work and to continue to educate the children and the families about how they can incorporate fresh ingredients into their meals. And earlier I talked about Atabay Consulting and Wendy Martinez, and you'll see on this slide earlier, when was it? Last month, we had an amazing press, secured amazing press for the story about the longest living LVAD patient at Newark Beth Israel. Her name is Myra Rodriguez, and she's actually been living with her artificial heart pump for 14 years, making her the longest living LVAD patient in New Jersey. And with the help of Wendy Martinez, we were able to secure so much media coverage for her in the Hispanic press. We got NJ.com, we got ROI New Jersey, News 12, but we also secured coverage in 8 major Hispanic media outlets, including Univision, Especialito newspaper, which I say is like the daily news of New York Daily News of Hispanic media outlets, and New Jersey Hispano News magazine. So that was very successful. And in addition to what we're doing as far as media, we're also working to ensure that we are increasing our search engine optimization on our own media outlets. So if you look here, our RWJBarnabas Health Social Impact and Community Investment Practice tackles increases in food insecurity following the pandemic. So that is an article, that is a donation. We've been working with the Common Market to supply fresh food boxes to different community organizations who are then providing those fresh food boxes to people who need it within the community. And so we want to make sure that these stories get out there and posting them on our blog. And of course, securing media, I believe that we're working to schedule an interview for her later this month about this very topic, and I know she's going to talk a little bit more about that when she begins. But basically, the pandemic, it really highlighted a lot of needs and a lot of gaps in our healthcare system. And one of those was the supply chain and getting supplies to local food pantries. And so we were able to partner with the Common Market to bridge that gap, fill that hole, and be able to get more, to smooth out the supply chain and be able to get much needed fresh foods and produce to these food pantries during the pandemic, and now we continue with that partnership. Next slide. And so we're also working to get the word out to our external audiences, do the press outreach, but we're also working on our website. And so as Diana mentioned earlier, we now are posting all of these corporate anchor roundtables on our RWJBarnabasHealth.org social impact page. You can watch this entire video, or you can also watch clips of each person's presentation, so that it basically extends the life of these videos and something that we can share, reach more people through these videos. You now have links that we can post on social media, and that also helps with our Google search as well. So we've placed, I think, the last 3, starting from December, well, the last 2, and now this one will also be posted. So it just gives us a wealth of content to place online. And we're also making sure that our internal audiences are definitely aware of everything that we're doing. I think we can go to the next slide. So we're constantly posting our all of what we're doing in System News and RWJBarnabas Weekly Roundup from our Season of Service activities, which took place in February as part of Black History Month with Jersey Cares, where employees volunteered to make quilts to deliver to homeless shelters throughout the state. And also our farmers markets, we're offering employees and visitors to our facilities fresh food boxes. You'll see that the fresh food boxes are now actually available at Cooperman and at Newark Beth Israel Medical Center, and we're looking forward to having them available at Jersey City Medical Center, Clara, Mass, Rahway, and Hamilton. And just to highlight another key point here, we also partnered with Epic to provide tablets and virtual training to seniors in Newark. Many of them obviously were homebound during the pandemic and needed to, in an effort to help them reestablish their social connections and involvement in the community. We did some training with them on how to connect to the internet, use email, basic things that I'm sure we take for granted, but are very important, especially during this time. You can move to the next slide. And then moving forward. So we're doing a lot, and we have a lot coming up. We have the Buy Local portal, as was discussed earlier, that's going to launch at the end of this month. And we're working with our internal communications team, led by Sharon Scalora, and with our creative services team to ensure that our employees and our external partners are aware of this portal and prepared to fully participate. You're going to start seeing some items in System News. You'll see some housewide emails. You'll see some brochures coming out and press releases to that effect, as well as social media posts. And we are also working with, we're also working on our new health equity social media presence. As was discussed, a lot of the work that we're doing in health equity, many of the departments, we're all trying to work in the same direction. We'd like to flow all in the same direction. And so hopefully our new health equity Facebook, Instagram, Twitter, and LinkedIn accounts will help us to that effect. We launched it. We started posting on Friday, actually, with posts about Juneteenth, and we're going to continue because a lot of that work in ERT, social impact, global and community health, it all touches and overlaps in many areas. And we would like, the public to know of RWJBarnabas Health's total commitment in that space. And later this year, we are going to be working with Rachel Gary, one of our women-owned vendors, on our social impact and community investment brag book. And that's looking at everything that we've done, really to highlight what's been done in social impact and community investment since the beginning in 2017, and looking at some of the major accomplishments, as well as what we have to look forward to and what's coming up in 2022 and in the years to come. And then we have also contracted with a local minority-owned vendor, owner of Dream Play Media, who's going to be developing a comprehensive video that highlights social impact and community investment, the work that's been done throughout with our anchor mission, as well as with our food security, the Hire by Local initiative. And so we'll be working on all of those areas. And that's really what we have coming up.